Today here we're working with Janine. What we're taking a look at today is scoliosis. So with scoliosis, what we do when we design a rehab protocol and a rehab plan for someone who's highly active or somebody who's active with scoliosis, in order to design that appropriate rehabilitation plan, we want to take a look at key angles and how their body's developed. So as we take a look at her posture here, we have a couple different angles that we look at when we analyze posture in an individual. So from the back, what we have is called the coronal plane. So we can kind of see either the front of the body or the back of the body. Oh, sorry, either the front of the body or the back of the body. And then we also have the sagittal angle or the sagittal plane, where we're just taking a look at how their body kind of moves in a forward and backward direction. And then the third plane would be a rotational plane. We're not going to take a look at that quite yet. So a couple different angles that we're looking at when we're designing that program is we're going to take a look at that spine and how the spine's aligned relative to the adjacent structures of the adjacent joints. So here, when we take a look at her shoulder height, when we start from the top, when we take a look at her shoulder height, you see that the right side's higher than the left side. And then if you move down the spine, you're going to see that that shoulder blade is higher than the left side. So when we take a look at this shoulder blade, you can see how it's like winging, and part of that's due to the vertebral rotation from the scoliosis. So we'll take that into account as we design like a shoulder rehabilitation plan. And then also when she's like working on doing dynamic multi-joint exercises while she's at CrossFit and doing functional exercises, the next thing we're gonna do is move down that spine. If you move it down that spine, you can kind of start to see how that spine sways over to the right. So she has like a little bit of a C curve going towards her right side. So when we think about what could be going on in this position of the body, is that all these muscles are going to be extremely tight. So when you're looking at pain relief, you want to focus on doing opposing directions to stretch out those muscles and stretch out those joints. So when she's moving around and doing those functional exercises, what happens there is that she's activating those muscles, and over the course of time, those muscles will continue to contract and contract and contract, and they only get tighter. So if you don't work in that rehabilitation plan and you don't work on stretching out those muscles, this will kind of chronically like lead into pain, and that will chronically cause that individual to go see a medical provider, whether that's like a doctor, a PT, or a chiropractor. So then when we move down a little bit further, we see that at her pelvic height is a little off, where her right side's a little bit higher than the left side. So again, it's kind of further strengthening our theory and our belief that that right side is completely shortened. So then moving down that spine, we're going to take a look at the PSISs, which is basically a couple landmarks on the pelvis that will show the position of how the pelvis is sitting in a forward and backward direction. And then, so if we move from the coronal plane to the sagittal plane, I'm just going to have you step over to the left a little bit. So if you come from the side, you're going to see that her way to kind of correct her posture is to have a hyperlordotic spinal position. So what's happening here is that when she goes to activate those muscles and move throughout the day, these vertebrae and these muscles are already extremely shortened. So this can be like a source of pain generation over the course of like a prolonged period of time. So going to see a PT will be very helpful in terms of like relaxing and stretching out those muscles. And then when we take another look at the front of the body, you're looking at the pelvic position of that anterior, the ASIS, or your anterior superior iliac spine. So you can kind of see how there's like a downward tilt there. So again, these are all these like micro compensations that we're taking into account when we develop a home exercise program and develop like a rehabilitation plan. So if you kind of go up the spine too and take a look at that shoulder, the right shoulder blade, because of the pec tightness and the way that the vertebrae is rotated, your right shoulder is your right shoulder is sitting a little bit more forward. So when she goes to reach up overhead, whether that's doing pull-ups or whether that's reaching into a cabinet, she's going to create like a little bit of an impingement syndrome going on there. So again, you know, there's a lot of little tweaks that we have to make in order to like get somebody to operate at a full capacity. And then moving down the spine, when we take a look from the hips down, there's some micro positional changes in her stance position to accommodate for the scoliosis, where her left foot sits a little bit further and there's a little bit of a knee flexion angle when she's standing, and then the right side's completely straight. So it's just something that's minor, but when you're thinking about running or jumping or going up and down stairs, it can kind of lead to chronic repetitive stress over the course of time. And if we have Janine lie down on her back, we'll take a look at the, place your head over here. If we take a look at Janine from the head looking down, you can see that her right shoulder is positioned fairly at a much more anterior pitch than the left side. So again, you know, that's just going to cause her to run into the possibility of impingement syndromes. So when we take a look at scoliosis, there's a lot of micro adjustments, as you can see, that the body makes to compensate and overcome those challenges. The key that you want to do is get into PT early and work on the stretching and the strengthening to normalize that balance and learn how your body should move in an optimal way, so that the pain doesn't generate over the course of time and lead you into, you know, necessarily possibly like needing surgery or possibly needing medication or just unnecessary pain.